you as a caregiver, what has been your experience with the treatment plan of the patient? Were you involved in the creation of that treatment plan as a caregiver?
Yes, I believe I was. As a caregiver, I went through and I went to all the doctor's appointments, and I kept notes on everything that we talked about at the doctor's appointments, where I had my questions. And after the doctor's office, I continued to keep track of things. So between me and our doctor, and obviously my lovely wife, we would discuss things, what worked, what didn't seem to be working. This medication sort of caused this, so maybe it's time to move on to something else. And as you guys go along, you're continually making course corrections for us. So when we were going into the second transplant, and our doctor was making the treatment plan, we discussed it, and it came down to the immunosuppressant that she wanted to use. I was like, first, I don't want to go there. I had a bad time with the last time. She said, I know there was some toxicity, but I really think this is the best way to go. I think we'll have the best chance for success. And I said, well, what you don't see in the medical records is that due to that toxicity, my wife she had no idea who I was for over a week. And that's a very strange feeling, especially as is this temporary? Is this going to be permanent? But that was a very scary time. And I wasn't going back there again. So, but once I explained that to the doctor, she agreed with me, and we switched to the other immunosuppressant. So, I believe it's very important for the doctors to listen to the caregivers, and also not blindly, but you need to understand the caregiver and her capabilities, and take as much information as you can to help with your overall plan.